Okay, this is video 3 on calcaneus fracture and what I went through as a patient. This is the orthopedic surgeon appointment. So I was able to get in with an outstanding orthopedic surgeon here in Houston, Texas. The guy is just renowned for the work that he did, and honestly, he's the entire reason, frankly, that I'm able to walk today. I will tell you, though, it was depressing and shocking at the same time. I had no idea how severe this was till I went in there. My heel had shattered into multiple pieces, and then bone fragments had gone across my foot, and I tore all the tendons off, and then I actually broke the lower part of my leg at the same time. He did tell me that it was one of the worst that he'd ever seen, and was fairly, sober in telling me that, this was going to be he was sober in telling me that this was going to be a long healing process, and that hopefully I could get back the majority of my mobility, but there was really no guarantee with that, and that I might have to possibly use a cane or have a limp. That was not certainly something that I was really excited to hear. And then he also then spoke about the fracture blisters that I mentioned in the last video, that those show how much pressure went into my foot, and that it was a very serious injury. And so one of the things that they wanted to do after that was they needed to get the swelling down before they could actually do surgery. So we waited about a week. He gave me additional pain medication at that point. Had me keep my foot up in the leg, the leg cushion that I ended up purchasing, and had ice put on it, etc. So I had to wait until that took place. A couple of other things that he mentioned to me is that they were going to go in and basically make an L cut along the bottom of my foot and then up through my ankle. And that cut is probably 5 inches along the bottom of my foot and probably 5 inches up the ankle. And that they would peel that back and then reconnect all of those pieces together. And I'll talk a little bit about that in the next video as to exactly kind of what they did. And that was going to be then stitched back up, and that then I would have a process of basically 6 weeks bandaged up. I'd have to come in and have them take a look at it along the way, and then they would put me in casts. I think I went through 2 different casts, and had those put on, but I couldn't walk on it. It was just to try to keep it stable so that it could everything could actually heal, and then go into a boot from there. So it was really, a 5-month process going through all of that. And of course, then there was physical therapy. He said that I would need as well. A couple of things that at this point, which we did, is we ended up going out and buying a sleeve that could go along over the top of my leg and seal it off, so that when I took a shower, it didn't get the leg wet. That was really important. We tried doing it with a trash bag. It really didn't work out real well. So you may want to go and invest some money into that. We got that at one of the local pharmacies here. A thing you're going to start to realize as a patient is you're going to need a lot of help. It just is what it is. Hopefully you've got a great partner that can help you get along with this, because literally you're completely at the mercy of your leg and the pain at that point in time. So we did do the sleeve. The other thing that you may want to start to take a look at that point is a scooter to be able to get along with, because you're going to have at some point in time where you're going to be able to put your knee up on a scooter and then kind of be able to walk along. We ended up borrowing one from a friend of ours, but it was a three-wheel scooter. I wouldn't recommend that. I would recommend a four-wheel, because while you're trying to wheel, sometimes you get off balance, and I'd get off balance every once in a while and fall over. And so I think I'd look at a four-wheel. The other thing to take into consideration is actually getting like a little light, maybe a headband light that you can wear, taking that light and putting it on the front of the scooter if it doesn't have a light, so that then in the middle of the night, if you need to get up, you can turn that light on and it'll give you some visibility as you start to move forward. But I think you can get those scooters at a medical supply house as well. But you'll definitely need it after surgery, so make sure you kind of get those things lined up beforehand. And next video we'll go into day of surgery.